Well, ladies and gentlemen, a very warm welcome to eCancer, to our special network on cancer, conflict and Ukraine. I'm Richard Sullivan from Guy's Hospital in London, and I'm also the chairman of the eCancer Trustees. And it's fabulous to welcome back to eCancer Natasha Bolaños, who is from the Lymphoma Coalition. Natasha's done some incredible work and leadership in patients with blood cancers in Ukraine and outside Ukraine. We last spoke in April last year, I think it was, Natasha. It's unbelievable. A year later, the conflict, of course, still rages. And today we're going to be talking with Natasha about some of the work the coalition's been doing, particularly to support patients with blood cancer, both within Ukraine and outside. Natasha, warm welcome. Let me begin by asking you to just describe the experiences of the coalition since we last spoke in April. Obviously, we went through a long winter. There's been a lot of changes, a lot of dynamic changes. Tell us a little bit about your experience with the coalition.
Yes, Richard, thanks for inviting us again and for trying to provide a review of this year of action. Well, last year was, that we started, the first thing we did was offering our support to the Ukrainian Hematology Association and also to our member organization in Ukraine, a patient organization. And they both asked us about bringing patients abroad because they have concerns about continuity of care, continuity of treatment. And that's what we did. We worked hard and in partnership with many, many other organizations and scientific societies, we succeed to bring patients abroad. And we were quite proud of that work. We are now offering best treatments or novel treatments that they could have never, ever received in Ukraine because it's not approved or is approved, it's not reimbursed. So we were proud of that work. And last year was pretty much about that, about bringing patients abroad, trying to find the best hospital with the best key opinion leaders, the best treatments available. We were trying to offer, cell therapy, bone marrow transplantation, and innovative treatments, to patients, not only as a way to ensure that continuity of care and treatment, but also as a way to really speed up the recovery of these patients and offering more hope. But soon we started to discover that something was wrong, that patients, although conscious about the opportunity they were having of getting better treatments, they were missing what they had in Ukraine. And at the beginning, it took some time to understand what this was about. We were thinking, this is because they are far from their family, they are far from their land, they are also worried about, the conflict and itself and how this could impact their opportunities to come back, because everyone wanted to come back. And that's still the case. At the same time, we continue the rest of the year monitoring the situation in Ukraine, monitoring the capacity of the Ukrainian health system, the hospitals, the centers here and there, to continue providing, certain level of diagnosis, certain level of treatments, even if it was not, the best treatment ever, but at least treatment compliant with standards of care, and also supporting the system itself and the clinicians by bringing to the country some equipments. During the winter, it was quite hard, because, we all know about the lack of power, how that was a special target during the winter time. So we were also worried about bringing some technical equipment to help them to restore that power or to have certain autonomy to continue the operations in the hospitals, even if they had no access to power at national level. But we continue exploring this kind of lack of the right care according to the Ukrainian patient's perspective. And we started to identify that this was about the psychological support that patients receive normally in Ukraine. I don't know if it's as a way to compensate lack of access to novel treatments. Clinicians in Ukraine, or probably they are more conscious about how important it is to spend time with patients, to connect with them, to really make them feel that you are not treating a disease, and a kind of abstract thing, but you are really treating a person, and they care about the person behind the disease. I'm not telling that clinicians abroad, especially in Western Europe countries, do not care about people. I really want to stress the lack of time. They are expected to do too much in terms of the numbers of patients they are treating. There is a big problem with the workforce in healthcare in general. We have less than what we need, especially in hematology. I would stress this applies also to the nurses, and they cannot spend long time with each patient. Sometimes they have only 5 minutes, and they need to choose, okay, how I will spend those 5 minutes. Do I talk about the treatment? Do I talk about the symptoms? Do I talk about, the psychological impact of the disease? And to their eyes, of course, this is about clinical outcomes. They really want to control the disease. That's their priority. I'm not even sure if the clinicians, the hematologists, should be the ones providing that kind of psychological support, because we have real experts in psycho-oncology. But I'm talking about what is missed, especially Western European countries, when it comes to provide cancer care. Cancer impacts the whole family, and it's a huge disruption. So we learned that our priorities should change. For those interested, we continue offering them to bring them abroad. It was true that also during the winter time, it was quite hard to continue doing that. And the uncertainty, about the conflict, the evolution of the country made planning very difficult. But we also understood that we needed to listen more what they really wanted and what they really would like to have. And this was about providing opportunities to get stronger, to the local clinicians, to continue supporting them by understanding what kind of priorities they had to keep essential services at least ongoing. It's also about planning the future. Hopefully we will have a future, but it is clear to all of us that this conflict is not about to end soon.
I just wonder, just to ask you about that and pick on what you just said there, looking at the future as well. You've got a great deal of insights into the capacity to deliver treatments for blood cancers within Ukraine. What are your major concerns going forward over the sort of next 6 to 12 months? Is that capacity stable? Is it sustainable? Are there significant issues still with the logistic supplies of pharmaceuticals? Something I know you picked up last time we talked last year was the logistic supply lines. What's your sense of things?
Well, my sense of things is that this continues being very difficult and will continue being more difficult. And also because people are getting used to have this conflict in the background. And some people are moving forward. And I fully understand, the reasons for doing that, because there are critical choices and there are critical trade-offs also for some organizations. If I see inside Lymphoma Coalition, we were not a humanitarian aid organization before Ukraine. We are not right now. And we don't want to be that, because we have a mission in the lymphoma field and we cannot leave that mission behind. But it is clear that we need not only to restore standards of care in Ukraine, but also help with the recovery and the reconstruction of the system, thinking in the long-term consequences for the health system. So we need to understand where it was before the conflict started. And the logistic supply should be about transparency. Everybody to get to know what's coming in, how it's coming in, and who's getting what, and where it's coming from. That's not clear for anybody at the moment. For me, has been really challenging to discover what medicines are coming, who are sending those, and who are getting those, and what channels have been used, to get them in to the hospitals. And there are some partners that have been working very hard in this special setting, especially from Germany, bringing medicines, equipments, generators for power during the winter, and they succeed to do that. But even for them has been very, very difficult because the lack of transparency, and also because the bureaucracy behind. Is really incredible that with this conflict, we continue dealing with bureaucracy. There was a moment where the Ministry of Health were expecting to get information about every patient in need of coming abroad to receive treatment. That means that clinicians needed to send the case, present the case into the Ministry of Health, getting the authorization for bringing this patient abroad. In the meantime, they were dealing with, discovering what hospital should I come, what clinicians are going to treat, what treatments they are going to get. Patients cannot wait for that, at least not in the blood cancer space. This is about life. This is about people dying, and this is about, every day counts. And how you can, in a situation where clinicians need to deal with bombs coming into the hospitals, with power suddenly being interrupted when they are in the middle of a process, in the middle of an infusion, in the middle, and they still need to deal with bureaucracy. So we need to reduce bureaucracy. We need to reduce the processes, the steps. We need more transparency. We need more accountability. We need systems that are reliable, and we need clear sources for funding and for bringing medicines in and technical equipment. I'm not doing this because we are in a conflict, but really thinking how we can do this, thinking in the future. So everything we bring in should be to also try to improve standard of care in Ukraine and to equip them better for the future.
That's a marvelous point. And maybe I would just want to pick up what you talked about it earlier on, which was obviously the access to some of the more cutting edge treatments now in blood cancers. Do you get a sense, and this is where I really want to wrap up the discussion, is going forward into the future that patient expectations now will have changed within Ukraine? Because I mean, these are about standard of care, and standard of care, of course, differs wildly across Europe. You as an organization have advocated very strongly for equity and equitability in access to the best standards of care. Do you think this is now going to change service delivery within Ukraine? And I guess the back question, of course, is this is all going to require money and funding. And as you said, along with the transparency in building capacity and capability, there's going to be required a focus on blood cancers within the new national cancer planning. Do you get a sense from talking to patients that expectations have changed?
I think so. I think that especially those patients that had the opportunity to test another healthcare system would be able to recognize what they miss. I mean, what are the strengths of what they had inside, but also the weaknesses. I think that all of them have a vision for a health service reform in Ukraine, where the expectation is being more harmonized with the standards of care internationally. Even in Poland, I mean, if you compare what is approved and reimbursed in Poland, has nothing to do with what is approved and reimbursed in UK or in Italy or in France or Germany. But even in Poland, they couldn't provide the same treatments patients were getting in Ukraine when Ukrainian blood cancer patients came in, because it was discarded from the reimbursed medicines because of the toxicity and were replaced for new medicines. So this is also about continuity of care. And this is a call to the European Commission. And I get really sad, and more than sad, angry. And, when I see these barriers between the member states and the non-member states, because Europe is, for me, is only one. And cross borders is there. And this conflict has proved that this is not about member states. The COVID before proved that no one will be safe until everyone will be safe. So I would envision to see more inclusion for policy making in general. I understand the need to have some regional approaches for certain things, but when it comes to policy and when it comes to this kind of big decision making, I think we should be more inclusive and more about equity, because every patient crossing the border can put in risk the next place where they come, but can also bring learnings to the new place where they come. And we should be looking for a standard of care for everybody, where no matter where you go, no matter where you are, you can receive the same and you have access to the same. Otherwise, continuity of care is really compromised. Moreover, we can put life in risk because there is no clinical evidence. I mean, no one has done clinical trials with certain sequences of treatments. And we suddenly were working with those sequences because that was the only way to continue providing treatments. But whenever these patients will come back to Ukraine, if they don't have access to that treatment that was provided abroad, they will come to the old treatment, and there's no evidence about that sequence. And we don't know the consequences of doing that kind of changes in the sequences of treatments or the combinations. Or so this goes beyond our concepts of standard of care. So this has been an eye-opener, at least for us, and really provide us with a more clear understanding where the priorities should be. And every time we take decisions in every country, we should see out of our borders what potential impacts this may have in our neighbors and beyond.
Fantastic. Thank you so much. I think it's a wonderful point to end on. The harmonization, as you say, the greater Europe, the idea of standardization of care, and patients should receive the same in every country. Absolutely, I think you hit the nail on the head. Natasha Bolaños from the Lymphoma Coalition, thank you so much once again for speaking to eCancer, and congratulations again for the marvelous work you've been doing over the last year for the whole of Europe, not just the Ukrainian patients. Thank you.